So a majority of lung cancer occurs in smokers, of course, but in fact, lung cancer does occur in never smokers. In fact, up to 20% of lung cancer in women is in women who've never smoked versus 10% of men with lung cancer who've never smoked. Some of the other risk factors are exposure to secondhand smoke, exposure to radon, which can be measured in the home, exposure to asbestos, and then also having an underlying lung disease as an additional risk factor. So having emphysema or lung fibrosis can put you at a high risk of lung cancer, and having a family history of lung cancer as well is an important risk factor. The unfortunate thing with lung cancer is that by the time you develop symptoms of lung cancer, often the disease is already at least locally advanced, if not metastatic. And so that's really why there's been so much interest in lung cancer screening. Now, if you do have symptoms, those symptoms may be cough, increased shortness of breath, some chest pain, maybe coughing blood is a concerning symptom, definitely, that needs to be assessed. And then more general symptoms like fatigue and weight loss, which really raise a flag about the possibility of more advanced disease. Really no big difference in terms of how men and women would present once they do develop symptoms. Currently, and the recommendations evolve over time, but the current guidelines are to have lung cancer screening if you're between the ages of 50 and 80, and if you have smoked at least 20 pack years, and there are calculators to estimate pack years, but that's really if you smoke, let's say, a pack a day for 20 years or half a pack a day for 40 years. And if you have quit smoking, then if you quit smoking within the last 15 years. Now, that being said, there are calculators to estimate the risk of lung cancer to determine whether you should or shouldn't have lung cancer screening that incorporate additional risk factors, like whether you have emphysema or if you have a family history of lung cancer. So a really helpful website that was put up by the University of Michigan actually is shouldiscreen.com, which has those guidelines, but has really nice kind of personalized calculators that you could look at and see whether, you know, what your risk of lung cancer is and whether you should seek lung cancer screening. And ultimately, I think what's most important is really to talk to your doctor about lung cancer screening. Typically, patients with earlier stage lung cancer would be eligible for surgery, and patients with more advanced disease would typically have treatments like chemotherapy, radiation therapy, targeted therapy, which are based on specific molecular markers. If they are present, that can be targeted with a specific therapy, and newer immunotherapy treatments, which the initial studies were really looking at patients with metastatic disease, but in fact now have become part of the treatment of patients with locally advanced lung cancer, and now in fact are entering clinical practice in the pre-operative treatment of lung cancer. So patients with more advanced disease, but that could be resected, can have a combination of chemotherapy and immunotherapy prior to going on to surgery. And of course, these types of treatment decisions are very much based on team discussions between pulmonologists, surgeons, oncologists, and radiation oncologists, as well as our colleagues from radiology and pathology. So very important that thoracic oncology tumor board, very important in terms of guiding our treatment decisions. But there's no question that the new immunotherapy treatments have really entered our practice and now are being used at a broader range of disease stage. And in a nutshell, what the idea of immunotherapy is really to help your own immune system recognize the tumor cells, because lung cancer and other tumors can have a way of evading the immune system to grow. And so this allows your own immune system to start recognizing the tumor cells as foreign and to help you fight against the cancer cells. So, in fact, as part of lung cancer investigation, as I was saying, there's a range of tests, imaging tests, but also biopsies. And in fact, when a biopsy is done nowadays, it's very important not just to confirm yes or no, is this lung cancer, but if it's lung cancer, what type of lung cancer is it? And then to go on to have both molecular analyses to know, for example, a marker like PD-L1, which helps guide the use of immunotherapy, and molecular testing that looks like EGFR and ALK mutations that can be targeted with a specific therapy. So, in fact, it's extremely important in patients with advanced disease because those targeted therapies have a very important role. But in fact, even in earlier disease now, if we're considering using in someone who has a bigger tumor maybe, but could have surgery and is going to have chemotherapy, immunotherapy ahead of possible surgery, then we want to know those molecular markers, because that information is very important so that the treatment team can make the best choices for treatment. And really, molecular markers are part of that personalized treatment of lung cancer, that you can have the best possible treatment, and often multimodality treatment for your specific tumor type. So locally, wherever you're being treated for lung cancer, there may be the option for clinical trials, but as well in the US websites like the American Lung Association website or the National Cancer Institute website, there's places where you can find out more about ongoing treatments and then the institution associated with these various trials.